Different types of schizophrenia. Schizophrenia is a mental health condition that affects a person's thoughts and behaviors. The classifications and types of schizophrenia have changed over the years. Schizophrenia is characterized by a range of thought and behavior-related symptoms such as delusions, hallucinations, and unusual ways of thinking. Schizophrenia typically involves psychosis, which is the loss of connection with reality in some form. This includes hearing voices or holding false beliefs that may lead to paranoia. This condition affects less than 1% of the people in the United States. People usually receive their diagnosis between their late teens and early 30s. Hallucinations and delusions, although not invariably present, are often a conspicuous symptom in schizophrenia. The most common hallucinations are auditory. The patient hears non-existent voices and believes in their reality. Patients with schizophrenia are subject to a wide variety of delusions, including many that are characteristically bizarre or absurd. One symptom common to most patients with schizophrenia is a loosening in their thought processes. This syndrome manifests itself as disorganized or incoherent thinking, illogical trains of mental association, and unclear or incomprehensible speech. The classification of schizophrenia types changed with the 2013 update of the manual that mental health professionals use to diagnose mental health conditions. This is called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. The previous version, the DSM-4, described the following 5 types of schizophrenia: paranoid type, disorganized type, catatonic type, undifferentiated type, and residual type. The current version, the DSM-5, no longer uses these categories. The features of these types, including paranoia, disorganized speech and behavior, and catatonia, are still features of a schizophrenic diagnosis, but experts no longer consider them distinct subtypes. The DSM committee made this decision because they recognized that the previous distinct types had overlapping symptoms and low diagnostic precision. When making a diagnosis of schizophrenia, a mental health professional will make a note of the person's specific symptoms and each symptom severity to determine the best treatment plan for the individual. The DSM-5 helps mental health professionals diagnose schizophrenia by describing key symptoms. They may diagnose schizophrenia if a person has at least 2 of the following symptoms for a significant amount of time, usually over 1 month: delusions, hallucinations, disorganized speech, very disorganized or catatonic behavior, negative symptoms such as reduced emotional expression. For a person to receive a diagnosis of schizophrenia, at least one of their symptoms must be delusions, hallucinations, or disorganized speech. The symptoms must also interfere with their work life, school life, social life, or self-care abilities. The severity of a person's schizophrenia will depend on the amount, frequency, and severity of each of these symptoms. The DSM-4 classified the following types of schizophrenia as separate conditions, but experts no longer recognize them as diagnostic categories since the publication of the DSM-5 in 2013. Paranoid type. Paranoid schizophrenia, or schizophrenia with paranoia, as doctors now call it, is the most common example of this mental illness. Paranoid symptoms. Delusions are fixed beliefs that seem real to you even when there's strong evidence they aren't. Paranoid delusions, also called delusions of persecution, reflect profound fear and anxiety along with the loss of the ability to tell what's real and what's not real. They might make you feel like a coworker is trying to hurt you, like poisoning your food, your spouse or partner is cheating on you, the government is spying on you, people in your neighborhood are plotting to harass you. These beliefs can cause trouble in your relationships, and if you think that strangers are going to hurt you, you may feel like staying inside or being alone. You could also have related hallucinations in which your senses aren't working right. For example, you may hear voices that make fun of you or insult you. They might also tell you to do harmful things, or you might see things that aren't really there. Disorganized type. Disorganized schizophrenia is one of the 5 subtypes of schizophrenia. It is characterized by disorganized behavior and speech and includes disturbance in emotional expression. Hallucinations and delusions are less pronounced with disorganized schizophrenia, but there is evidence of these symptoms occurring. Symptoms of disorganized schizophrenia. Disorganized speech. Schizophrenia can cause people to have difficulty concentrating and maintaining a train of thought, which manifests in the way they speak. People with disorganized speech might speak incoherently, respond to questions with unrelated answers, say illogical things, or shift topics frequently. Signs of disorganized speech involve the following. Loose associations, rapidly shifting between topics with no connections between topics. Perseveration, repeating the same things over and over again. Made up words that only have meaning to the speaker. Use of rhyming words without meaning. When cognitive disorganization is severe, it can be nearly impossible to understand what the person is saying. Disorganized behavior. Schizophrenia negatively impacts goal-directed behavior. A person with disorganized schizophrenia is likely to have difficulty beginning a specific task, for example, cooking a meal, or difficulty finishing a task. Independent functioning is exceptionally difficult due to this gross disorganization. Disorganized behavior can manifest as the following: a decline in overall daily functioning, unpredictable or inappropriate emotional responses, lack of impulse control, behaviors that appear bizarre or lack purpose. Routine behaviors such as bathing, dressing, or brushing teeth can be severely impaired or lost. Inappropriate affect. Affect refers to a person's emotional responses, including the way emotions are expressed. For example, smiling when feeling happy. People with disorganized schizophrenia exhibit flat affect, which means they show little or no emotions in their facial expressions, voice tones, or mannerisms. At times they exhibit affect that is inappropriate to the situation, such as laughing at something sad. In addition to lack of emotional expression, people with disorganized schizophrenia are likely to experience other negative symptoms, including failing to make eye contact and blunt facial expression. Development and course. Disorganized schizophrenia is associated with early onset between the ages of 15 to 25. Earlier age of onset is traditionally associated with a worse prognosis due to lower educational achievement, more prominent negative symptoms, and cognitive impairments. Early detection, diagnosis, and treatment of the disorder contributes to better outcomes. Catatonic type. Catatonia refers to a set of symptoms that might develop in some patients with schizophrenia. It can include periods where the individual moves very little and does not respond to instructions. At the other end of the extreme, the individual can demonstrate motor activity that is considered excessive and peculiar, such as echolalia, mimicking sounds, or echopraxia, mimicking movements. This is called catatonic excitement. Catatonic schizophrenia is much rarer than it used to be thanks to improved treatments. Catatonic states are now likely to be found in types of mental illness other than schizophrenia, such as neurodevelopmental conditions that affect children during the development of their nervous system, psychotic, bipolar, or depressive disorders. With modern treatments, patients with catatonic schizophrenia can manage their symptoms easier, making the likelihood of leading a happier and healthier life much greater. The clinical picture of catatonia is dominated by at least 3 of the following symptoms: stupor, no psychomotor activity, no interaction with the environment. Catalepsy includes adopting unusual postures. Waxy flexibility. If an examiner places the patient's arm in a position, they will maintain this position until it is moved again. Mutism, limited verbal responses. Negativism, little or no response to instructions or external stimuli. Posturing, actively holding a posture against gravity. Mannerism, carrying out odd, exaggerated actions. Stereotypy, repetitive movements without an apparent reason. Agitation for no known reason. Grimacing. Echolalia, mimicking another person's speech. And echopraxia, mimicking another person's movements. Undifferentiated type. The simple or undifferentiated subtype of schizophrenia typically is characterized by an insidious and gradual reduction in external relations and interests. The patient's emotions lack depth, and ideation is simple and refers to concrete things. There are a relative absence of mental activity, a progressive lessening in the use of inner resources, and a retreat to simpler or stereotyped forms of behavior. Residual type. The residual subtype is typically distinguished by the lack of distinct features that define the other types and is considered a less severe diagnosis. Individuals diagnosed with the residual type generally have a history of schizophrenia but have reduced psychotic symptoms. The different subtypes of schizophrenia are not mutually exclusive, and persons affected by schizophrenia may display a mixture of symptoms that defy convenient classification. There may also be a mixture of schizophrenic symptoms with those of other psychoses, notably those of the manic depressive group.